Yes, a very good morning today. Today is 18th of April 2020. Okay, I'm Professor Dr. Anita Ramesh. I'm here today to just give you some do's and don'ts and some practical tips for the general people as well as the medical fraternity, how to deal with cancer patients during this coronavirus pandemic. So I think all of us we don't know what to do. Last 100 years, the world has not seen such a devastating pandemic, and which implies to all aspects of our health. But then we should be strong, we should stay safe, and we should fight against this COVID pandemic. Be along with the national and the local guidelines and help us to fight it out together. Now, in the midst of the corona pandemic, cancer patients are there. What do we do? Cancer treatment may not be a priority, but still patients do need treatment, and we professionals have to deal with them in a proper way so that the treatment is completed. So today I would like to tell you a few do's and don'ts, both for the medical professionals as well as for the cancer patients itself and the family members. Now, avoid all type of cancer screening, avoid all type of master health checkup, reduce hospital visit as much as possible, reduce contact with the patient and attender and the hospital, try to finish off some consultations in telemedicine, WhatsApp, video calls, Zoom, SMS and emails. Yes, it has its own implication, but to be careful, be in touch with the doctor. Sometimes small emergencies can be handled in the local dispensary or nearby hospitals. The doctor can be in touch with the primary consultant, like general practice or GP services. Sometimes medicines can be delivered on a home basis. Sometimes patients on palliative care, end-of-life care, end stage do not need to visit to the hospital, can take local treatment under the guidance of the primary consultation through telemedicine. These treatment schedules of palliative and advanced cancer patient can be prolonged. Instead of 2 to 3 weeks, can be made 4 to 6 weeks. Sometimes the injectors can be changed into oral drugs so that they reduce the hospital visit. Unnecessary tests and investigations to be avoided. Interim scans for assessment to be avoided for the time being. Any sort of radiation during palliative, no new cases of radiation to be taken until and unless it's an emergency like spinal cord compression, brain metastasis. Avoid all sorts of bone marrow transplant, high-dose chemotherapy, because it will be difficult to manage the infection and the blood products during the stages of complications. And any sort of major elective surgery should be avoided. Only emergency services can be taken care. Any treatment for any benign disease to be avoided during the COVID. Wait till the lockdown is over and then please visit the hospital. Regarding the patients and the attenders, it is very important that you maintain the local hygiene. Try to wash the hands with soap and water. Otherwise, use alcohol sanitizer. Both on the hands aspect, any metal object like mobile phone, keys, pen, everything needs to be. If you avoid going outside, stay indoors until and unless it is definitely important or definitely it's very urgent that you need to go out. Those who are on treatment should abide by the rules and not leave the house. But even if you go out, maybe visit to the hospital and back, once you come back, you have to change your clothes, put it in soap water, take a full head bath. It is better to sanitize and clean the tabletops, all the objects which you are going to touch. Avoid guests anyhow, lockdown period, nobody is going to come, people from coming inside. Preferably to drink hot water or milk or any tea, coffee, that is preferable. Steam inhalation is good because the heat in the tea, coffee and the steam helps to kill the virus which is there in the oropharyngeal space and cavity. Next is preferably to eat a diet which is cooked at home, not bought from outside. Should have the Indian spicy things, spices and the like cinnamon, ginger, garlic, turmeric, chili, all are some sort of antioxidant effect, though it is not proven, but it is better to do that. Avoid any poultry for the time being. We do not know the relationship. Please avoid being touched with or in contact, close contact with any other individual, preferably a 1 meter distance to be maintained, because we don't know who is a COVID carrier. Anybody having cough, excessive fever, breathing difficulty, please wear a mask and shift to the hospital. There are COVID designated hospitals throughout the city, and you can take help there. Call the government helpline, and people are there to help you out. Please reach the hospital without wasting time. The persons who are health supporters of the patients also should visit the doctor if there's a necessary. Yes, and a cancer patient, whenever there is an emergency, you have to come to the hospital. I know there is a lockdown, but then once you get in touch with the traffic police and you show that you are for the traveling to the hospital for treatment, yes, they will definitely allow you. But don't make any unnecessary visits for small things. But yes, if you have a chemotherapy for a curable cancer, if you have radiation for a curable cancer, okay, or if you have some emergency, please visit the hospital. We are there working all the days, and I'm available on call, and I'm willing to take all teleconsultation, WhatsApp, SMS, and even phone call. And we do have running OPs in bigger hospitals with cancer center to take care of you. Stay safe, stay connected, follow the local and the national guidelines, and we'll be tied over this disease.